Oh, helps to turn the mic on. Hey everyone, how's everybody doing today? I hope you all are well. Now that I have the mic on, it is February 11th, 2018. It's Sunday, and you have reached another episode of Talk with the Doc. You all know who I am. I'm Dr. Nicole, your board certified family medicine physician. I specialize in managing, treating, and preventing chronic medical conditions and explaining those conditions in terms that everyday people can understand. Hey, Tara, thanks for joining in. Please share this video. I help pastors and congregations, people who are overworked, overwhelmed, and overweight, transform their minds, bodies, and spirits so that they can make a greater impact on everyone around them, their children, their communities, their congregations, everyone. All right. So thank you so much for joining me today. I do want to have everyone go and purchase my new book. It'll be out in just a couple of weeks. It's called The 12 Secrets to Divine Health. And you can get your copy pre-sale orders of your autographed copy at divinehealthbook.com. That's divinehealthbook.com. And you can get your autographed copy. And the book is going to be launching here just in a few weeks. All right. So stay tuned for more information about that. Like I said, I'm going to wait just another moment or so. Let some folks join in just in a few weeks. All right. So stay tuned for yeah, I hope everyone's had a great day. I'll admit I'm a little tired today. I just got back into town, and I should be resting, but I didn't want to miss my talk with the doc because I know how important it is for everyone to learn about medical conditions, all right, and in terms that you can understand. So, you know, like I said, this month is February. It's the month of love. It's the month that we celebrate the heart, okay? It's known as the American Heart Association's Heart Awareness Month. Hey, Miss Cleva, thanks for watching so much. Please share this video. And so it's American Heart Month, and so it's February. It's the month of love, the month of hearts and everything heart. So I said we're going to do Heart 101 this month, right? We're going to do everything about the heart. So the last week of January, we talked about the heart's anatomy. I explained to you how the heart is made up. You know, you've got the two atrium at the top, you've got the two ventricles at the bottom. We talked about all the vessels that are in the heart. We talked about how the heart squeezes. And then last week we talked about blood pressure, right? We talked about blood pressure and what that top number, the systolic, and the bottom number, the diastolic, that the goal is to be 120/80. What happens when you have high blood pressure and how high blood pressure can affect the rest of your body. And so today on Heart 101, this is module 3, and I'm titling this module 3, Don't Break My Heart. All right, now you all have seen, well, if you're old enough, you've seen the episodes of Fred Sanford when he used to grab his chest and say, I'm coming for you, Elizabeth. I'm coming. It's the big one. I'm coming. Okay, so what was he doing there? Okay, so he was acting out a heart attack. All right, and so that's what we're going to talk about today is heart attacks. What are they? What happens when they occur? What is actually happening in the body when that happens? And what causes heart attacks and what you can do to prevent heart attacks. All right, so that's what we're going to talk about today on Talk with the Doc. All right, let me just pull up my notes here. All right, so Heart attacks, what are they? All right, so what are they? They're so important because there's so many people that have heart attacks, and we're seeing, unfortunately, the numbers are going up with heart disease in women. We see the numbers going up in African Americans. We see the numbers going up just in general, and that's why, you know, February is America Heart Month. We go red for women. We're trying to bring awareness to heart disease and to issues that affect the heart, because unfortunately, we're seeing more numbers of heart disease, heart attacks, heart failure, and all of these conditions. All right. So what is a heart attack? What is it? Okay. So we talked a couple weeks ago about the heart. You know, it sits on the left side of your chest, and it's shaped kind of like it's more shaped like an apple than it is, you know, your typical, the heart that we all think of. No, it's more shaped like an apple. In fact, let me show you a picture of a heart. Okay, let me show you a picture. There's a heart, all right? So you got the top part of the heart here. You've got the bottom part of the heart here, all right? And if you can see there, all around the heart are these little blood vessels, right? We call those the coronary arteries, okay? Coronary arteries. So it's the arteries that actually feed the heart and actually bring the blood flow to the heart to keep the heart muscle with oxygen and keep the heart pumping, all right? So a myocardial infarction, ooh, a big word, right? So let's break it down. Myocardial is muscle. Myo means muscle. Cardia means heart. So that's the heart muscle, okay? So you've got all of this here is heart muscle, all right? So you've got heart muscle, so myocardial and infarction. And infarction means it's not receiving blood. So when you hear of a myocardial infarction or an MI, that means heart attack, all right? So now you know the fancy term for heart attack. It's myocardial infarction, and that means basically that the heart muscle is not getting blood supply, and so that portion of the heart dies, okay? And if the heart dies, then it doesn't pump blood, and if it doesn't pump blood, then you die, okay? So as you can see in this picture here, this is a picture of the blood vessels, and you can see here, right here, this portion of the heart is not getting blood, and that's why it's all kind of purplish color there. And so that portion of the heart is dying, all right? It's dying because it's not getting blood supply. So what happens with the heart attack? You get a clot in the artery that goes to that portion of the heart, and then the blood can't move past that clot, and then that portion of the heart doesn't get blood flow, and then it dies, okay? So that's where you get the heart attack. What we see, what the other thing that contributes to that is plaque in your arteries, all right? So if you had a large blood vessel or clot floating through vessels that didn't have plaque, you know, like if this is your blood vessel and this is the plaque, as long as it has room, if this is the clot, as long as it has room, it's not going to block anything. But when that vessel is already teeny tiny because it's got plaque all in it, all right, then that's when that clot can get stuck in there, all right? And when the clot gets stuck and blood can't move and blood can't flow to the rest of the heart, that's when the heart muscle dies, all right? So now that's the fancy term, myocardial infarction. In fact, let's show you a picture of that, what I just talked about. All right, so you see this is a blood vessel. This yellow stuff here is plaque in the artery, all right? And this little purple thing here is a clot. So when that clot gets stuck and the blood can't flow around it, then that's when you have a heart attack, okay? So that's what a heart attack is. It's a myocardial infarction where blood can't flow to a portion of the heart. Now, we have multiple vessels in our heart, multiple coronary arteries. You have the large one, which is called the left anterior descending artery. That's the artery where if you get a blockage there or if you get a clot there, they oftentimes call that one the widowmaker, okay? I know a lot of cardiologists say we don't use that term anymore, but that's what we used to call it. We used to call it the widowmaker because if that portion of the heart dies, that's a large portion of the heart that's causing the squeezing of the ventricles to get the blood out of the heart. So if that portion dies, it's pretty much fatal, all right? So you want to, there's other arteries as well. There's the right coronary artery. There's the left coronary artery. There's the arteries that go around the back of the side of the heart. There's the circumflex arteries. And really, any of those arteries that get blocked can be pretty detrimental. But the big one is the LAD, the left anterior descending artery, and that's the one that can be the widowmaker. All right. So that is what a heart attack is. It is a blood clot, or a place in the heart where blood can't flow anymore, and so that heart muscle dies. So why does this happen? Why does this happen? Well, we talked about having plaque in the arteries, okay? And so an unhealthy lifestyle can lead to plaque in the arteries. What we're eating can lead to plaques in the arteries. Sometimes our family history, if you have a family history of high cholesterol levels, high triglyceride levels, that's how much fat is in your bloodstream, how much plaque is in your blood vessels, then that can increase your risk of heart attacks. If you have, coronary artery disease or heart issues in your family, that can also raise your risk. If you have high blood pressure, that raises risk. And let me tell you why high blood pressure raises your risk of heart attacks. When your blood vessels constrict down, if a blood vessel is usually this big, when it gets constricted down, either because of plaque or because of, they can constrict for other different reasons. But when your blood vessels get small and your heart has to work harder to push that blood through the heart, that's through the vessels, that's where we start to see problems, all right? And so the smaller the blood vessels get, the more likelihood or the higher the risk factor that you can get a clot. All right, so what causes the clot that can cause the heart attack? Well, different things. But basically, if your blood is pooling, if it's not flowing the way it's supposed to flow, when the blood pools, or when it just sits stagnant or sits idly, it can form a clot, all right? And when it forms a clot, then when it finally does start moving again, you can be pushing that clot through the bloodstream, all right? And then if that clot reaches some place that has more plaque or a smaller artery, then it can get stuck. And when that clot sticks, that's when it causes the heart attack, all right? And of course, we talked about before a couple months ago, when a clot goes to the brain, it can cause a stroke. But in the heart, it causes a heart attack. So, like I said, risk factors include things like high blood pressure, having a sedentary lifestyle, if you have a family history, if you have heart failure, if you have diabetes. We do know that people with diabetes have almost a 3-time higher risk of having a heart attack than people that don't have diabetes. Why? Because diabetes also makes your blood thick, and when your blood is thick, it can form more clots because it moves slower, and when it forms more clots, then you can have more heart attacks, all right? So those are the risk factors for having a heart attack. So if you have any of those risk factors, some of those you can change. Oh, I didn't mention smoking. Smoking is a huge risk factor for heart attacks. So if you are a smoker, we talked about this last week, what I tell you, stop it, right? Stop. I know it's not easy, but stop, because you're at an increased risk of heart attacks, all right, and other bad things. So some risk factors can be changed. You can stop smoking. You can lose weight. You can become less sedentary and more active. You can eat a healthier diet. Unfortunately, there are some risk factors that can't be changed. Your family history, you can't change that, okay? We just got to say, thanks, family, but we can't change our family history, all right? We can't change our genetics. So what we have to tackle is the risk factors that we can take a hold of, all right? So what are the symptoms of a heart attack? How would you know if you're having a heart attack? Like I said, we've all seen Red Fox. He grabs his heart and he's staggering around and he's like, Elizabeth, it's the big one. I'm coming to see you, right? All right, so with heart attacks, what we generally see is a severe crushing chest pain on the left side of the heart, on the left side of the chest, all right? That chest pain can radiate up to the jaw. It can radiate over to the shoulder. It can radiate down to the left arm. It can hurt underneath your breastbone. It can, keep trying, Tara, keep trying. We're going to work with you, girl. We're going to work with you. It can cause indigestion. Your heart sits right on top of where your stomach actually sits, your actual stomach. And so when the heart muscle is dying, it can cause your stomach to be irritated and you can get indigestion. So sometimes people get indigestion as a symptom of a heart attack, all right? Now, you can get dizzy. It often causes you to sweat. You can also get pain in the back of your neck, pain in your neck. You can get pain in the center of your back. And then you can get, sometimes people can get numbness and tingling as well. All right. Now, ladies, sometimes you can have different symptoms of a heart attack than men get. All right. And men, people also get short of breath. All right. So what we typically see, like I said, shortness of breath, sweating, chest pain that radiates to the left shoulder, arm, or jaw. All right. And they can get fatigued, and sometimes they can pass out. All right. You can also get, like I said, neck pain, stomach pain, indigestion. Now, ladies, you get different symptoms a lot of times than men. I don't really know why, but sometimes most times women get different symptoms. Now, women can get the chest pain as well, but a lot of times women don't get the left-sided chest pain. Women can get right-sided chest pain. All right. So, ladies, if you have right-sided chest pain, if you have something that it feels like indigestion that won't go away, it won't get better. You tried some Tums, you've tried some Rolaids, and it's just still not getting better. You need to go see your doctor, like sooner than later. All right. Because indigestion that doesn't go away could be a sign of a heart attack. All right. You can get dizzy, you can get headaches, and like I said, you can get pain in the backs of the neck, like an aching in your neck. You can get pain in the middle of your back. All right. And you can also get right-sided symptoms, so right jaw pain, right numbness and tingling in your hands. All right. So when that happens, ladies, you need to go and get evaluated and make sure that you're not having a heart attack. All right. So what happens if you are having a heart attack? You're having a heart attack. You suddenly feel chest pain. You're short of breath. Sometimes you might pass out. Hopefully you're able to dial 911, or whoever's around you can dial 911. If you do pass out, or if you see someone with these symptoms and they pass out, you need to look for an AED, which is a automated external defibrillator. All right. And hopefully public places have them. Places like airports, places like libraries, places like sheriff's departments, churches should have AEDs. And so people should have AED machines, because if someone passes out and they're having a heart attack, you can put these two pads on. It can read the heart rhythm, and it can see if they're having a heart attack, if they need to be shocked. Okay. If they need to be shocked out of that heart rhythm to hopefully save their life. All right. So if you see someone that's having symptoms of a heart attack, first things first, you need to call 911. You need to call for help. What I say? First things first, call for help. Call 911. Get some help. All right. Find an AED machine if possible. All right. If they are still talking, you need to stay with them. If they have passed out, then you need to possibly start CPR. All right. And please go, everyone, and get certified in basic life support. Anybody can be certified in basic life support. Okay. You don't have to be a nurse or a doctor or a person in the medical field, but anyone can be certified as a basic life support provider. All right. So you were calling for help. You're calling 911. You're doing chest compressions if you have to. That person is transported to the hospital. When they go to the hospital, they'll get an EKG. The EKG will show us whether or not they're having a myocardial infarction, if portions of the heart are dead. All right. If that is the case, then they will oftentimes be taken immediately for a catheterization. Okay. And a catheterization is where they go in through either the groin or through the wrist into the artery, and it can go into the heart, and they can either put in a stent to open up those arteries. They can break up the clot that has caused the blockage, or they can sometimes use it like a little basket and catch the clot and pull it out. All right. So the clot has to be removed. The plaque that was kind of making the area narrow has to also be removed, and then that artery needs to be reopened back up. The whole point of treatment after a heart attack is to try and get the blood flow back to the heart, and hopefully it won't be permanent muscle loss if it can happen fast. So if you see someone having a heart attack or symptoms that look like a heart attack, it's very, very imperative that you move quickly to get them to a hospital, because you want to try and get them treatment as fast as they can so that they can get the blood flowing back so that you don't get permanent damage. All right. So once they have put in the stent or they've removed the clot, then you go into your post-recovery phase. And so you go into treatment. A lot of times you're going to be on, are there any pre-warning signs? Absolutely. And we'll talk about that in a moment, Ms. Tara. You want to they will oftentimes put you on a blood pressure medicine after you've had a heart attack. You will oftentimes be on some kind of blood thinner, whether that be an aspirin, whether that be something like Plavix or Xarelto. These are all blood thinners as well that can help to prevent any further clots that can cause more heart attacks. All right. And just because you've had one doesn't mean that it won't happen again. Okay. It can happen again. And in fact, you have a higher risk of it happening again once it's happened once. All right. So you want to really take your medicines, take your thinners, whatever thinner that your doctor recommends, whether that be the aspirin or the other prescription pills. And then you want to really get into the healthy lifestyle. So once you are released from the hospital, they will get you into what's called cardiac rehab. With cardiac rehab, they're going to be working on building back up your stamina, building back up your exercise and your tolerance. They're going to have you walking on the treadmill, riding the bike, doing the elliptical machine. They're going to talk to you about how to change your diet, about how to lower your cholesterol, okay, how to eat healthier so that you're not eating as much fried, fatty, greasy foods and clogging the arteries even more. We're going to be doing, encouraging more lean meats and fruits and vegetables, lots of water, because we want to keep that blood flowing, all right? If you have diabetes, really working hard on getting your sugars under control so that you're not walking around with thick blood that can also lead to more clots, right? All right, so those are the things that we do. A lot of times, too, after you've had a heart attack, we'll put you on something called a beta blocker. It's a class of medication that helps to protect the heart against further against further heart attacks and against heart disease, all right? Beta blockers slow the heart rate down, and it brings down the blood pressure. And like I said, it protects the heart from future heart attacks and future heart disease, all right? And so beta blockers end in LOL, L-O-L, all right? And we're not talking about laugh out loud. We're talking about a beta blocker like metoprolol or carvedilol, atenolol, okay? And those are protective of the heart, and those will help protect the heart from further future heart attacks, all right? And that brings me to what Miss Tara pointed out. Let's see here. I did have that written down. Hold on one second. About the pre-warning signs of a heart attack. And there absolutely are pre-warning signs. So, and we see this a lot of times, like I said, with ladies. If you are having lots of indigestion that won't go away, that could be a warning sign. If you are having dizziness, if you are feeling off balance, if you have been noticing your blood pressure going up and it's not able to be controlled, let's say before you didn't have high blood pressure and now you're having high blood pressure, that could be a reason to go and that's a warning sign. If you had normally well-controlled blood pressure, but now it's like going up really high, then that's also it could be a pre-warning sign. And like I said, women, because we get different symptoms, you're going to be looking for more of the right-sided heart attacks, right-sided symptoms, for the heart attack. All right. So arm pain on the right, jaw pain on the right, shortness of breath, feeling dizzy. These are all the things that can be warning signs for the heart. Like I said, if you have any type of discomfort in the chest. Now, there is something called angina, which just means chest pain, all right? And now, stable angina is chest pain with exertion. So let's say you're walking and suddenly you get chest pain, you get shortness of breath, all right? If you're having angina, that is a warning sign for your blood is not flowing as well, all right? Versus unstable angina just means you have chest pain all the time, even at rest, all right? But if you have stable angina, that is a huge warning sign that there is some blood flow that's not getting to where it needs to get, all right, and that you might be having, you could have a heart attack in the future, all right? You also want to make sure, like I said, if you're getting winded, if you're getting really tired with exertion, then that is another pre-warning sign that you need to kind of watch out for and need to go get checked out. And again, if you have diabetes and your sugars are higher than usual, that's another warning sign that you need to go and get checked out, all right? So, all right, we talked about the risk factors. We talked about the symptoms. We talked about treatment. rehab. Okay, like I said, you're going to go to rehab if you've had a heart attack, because we want to build up your stamina. We want to get that blood flowing. We want to improve the blood flow in your arteries. All right. So what can you do then prevention wise to help prevent heart attacks? Well, we did talked about a big one. Stop smoking. All right, because we know that smoking causes more plaque in the arteries. Smoking constricts the arteries, and smoking it mainly is the plaque that it causes in the arteries. All right, so one is stop smoking. Two is taking care of your blood sugar. All right, making sure. Have you guys ever seen when you make? Have you ever put sugar into water? Okay, like let's say you're making Kool-Aid or something, and you put sugar in water. You know how thick that water gets when you have sweet sugar water. Think of your blood like water, and then when you have diabetes, there's sugar in the blood, and so what happens to that blood that water that was nice and thin before? It becomes thick. Same thing with your blood. So when you have sugar or diabetes in your bloodstream, your blood becomes thick. When you have thick blood, it's harder to move through the arteries, and then when it's harder to move through the arteries, it can get stuck and it can cause a heart attack. All right. So you want to take care of your blood sugar. Okay. So stop smoking, take care of your blood sugar. And then you also want to eat a healthy diet. I mean, you guys are like, Dr. Nicole, you are always saying eat a healthy diet. I know, because it's so imperative with all of these conditions that we talk about that you have to eat a healthy diet. All right. So lean red meats if you're going to eat red meat. More fruits, more vegetables. All right. You want to decrease the amount of artificial foods, gluten and carbohydrates that you're eating. Those are the big things that you want to do. Get rid of your sugary drinks. Okay. You know, the Kool-Aids and the sodas and the juices, unless it's fresh squeezed juice, because these are the things that can slow the blood flow down and keep it's just not good for you. All right. The next thing and the big thing is exercise. When you exercise, you are bringing in more oxygen, and you're getting more oxygen to the parts of the body that need it. All right. So exercise more. We recommend 30 minutes a day, 5 days a week. However you can get it in. All right. However you can get it in. That's 3 10-minute spurts, 2 15-minute spurts. Park farther away at the grocery store, walk up the steps instead of taking the elevator. But whatever you can do, get your 30 minutes of exercise in each day. All right. That's how you can help prevent heart attacks. All right. Also, if you have diabetes, or if you've had anything going on with your heart, your doctor may, your doctor needs to tell you this, but your doctor may encourage you and recommend that you take an aspirin a day. Why? Aspirin thins out the blood, and when your blood is thinner, you won't get the clot that can cause the heart attack. All right. So if you've had a heart attack in the past, I'm sure your doctor probably already has you on an aspirin. All right. Make sure you're taking that aspirin every day. It really does help to prevent future heart attacks. All right. So, also, things like treating sleep apnea. Okay, so if you have sleep apnea, if you snore and you're tired all the time, and we'll do a whole nother talk just on sleep apnea, but if you have sleep apnea, when you need to talk about, you need to treat the sleep apnea, because you need to increase the oxygen that goes into the blood to get to the tissues, including the heart tissue. All right, so that's just a little bit about the heart, okay, and heart attacks. So we talked about that. What a heart attack is, it's a myocardial infarction, which basically means a portion of the heart is not getting blood flow. We talked about the risk factors like family history, sedentary lifestyle, if you're a smoker, if you have diabetes, if you have high cholesterol. We talked about the symptoms of a heart attack, that crushing chest pain just beneath the middle of the chest, sometimes in the left side of the chest, radiates to the jaw, radiates to the shoulder, radiates down the arm. Ladies, yours can radiate down the right arm as well. You can have neck pain, you can have back pain, you can get dizzy, you can start sweating, you can have indigestion. If you have any of those symptoms, go to the emergency room right away. All right, when they do find out that you've had a heart attack, they will often go in and they have to remove the clot, or they have to put a stent in to keep the blood flowing. All right, and then they're going to put you in rehab. Okay, you're going to be in cardiac rehab, because we want to build back up your stamina and help you get a healthier lifestyle and with exercise, so that you can prevent further strokes. All right, and then it's all about prevention, guys. All about prevention. If you're a smoker, come and get some help. Okay, so that we can get you to stop smoking, get your control of your blood sugars, increase your exercise, eat a healthier diet. Manage your blood pressure. Keep your blood pressure 120/80. That's going to be optimal. All right. And then see your doctor regularly. Take your medicines that they have you put on. Take your aspirin if they have you on an aspirin. Take your blood pressure medicines and your diabetes medicines. All right. Try and live a healthy lifestyle, because that's going to be the things that's going to help prevent heart attacks in the future. All right. So that we won't have any red fox grabbing of the chest. Elizabeth, it's the big one. It's the big one. Right. All right. So thank you all for joining me today on today's episode of Talk with the Doc, Heart 101, Module 3, all about heart attacks. You all know who I am. I'm Dr. Nicole, your board-certified family medicine physician. I specialize in managing, treating, and preventing chronic medical conditions and explaining those conditions in terms that everyday people can understand. Through my books, my seminars, and my concierge medical practice, I help pastors and busy professionals, people who are overworked, overwhelmed, and overweight, transform their mind, body, and spirit so that they can make a greater impact on their children, congregations, and communities. Again, please watch out. It's going to be in the next maybe 2 or 3 weeks. We are going to be doing the book launch, right? The 12 Secrets to Divine Health. My book is coming out. Yay! And I'm going to invite you all to come to my virtual book launch, all right? It's going to be in a few weeks, but you can pre-order your book today by going to divinehealthbook.com. I'm going to put it in the comments, divinehealthbook.com, and you can learn all of the secrets to becoming healthy, all right, to having divine health. That's health in your mind, body, and spirit, all right? Thanks so much again for joining me today, and I look forward to speaking with you next week. Next week, we're going to talk about preventing heart disease, all right? All about heart disease prevention. All right, and we are going to have a great time. Please share this video and invite your friends to come out for Talk with the Doc every Sunday, 3 p.m. Eastern Standard Time, and I will see you guys then. I'm going to go out today with a little song that I wrote that says, I'm going to keep loving you, and I do. You guys, I love sharing information with you all and giving you all information because when you know better, you do better. You know, I'm Dr. Nicole, D.O., Doctor of Osteopathy, but I say do because I want you to do better, all right? Do better. So I will see you all next week. Please go get the book, divinehealthbook.com, all right? See you later.